we're going to come back to that. So take your feet
Hey, Robbins Nation, welcome to CoFIT-20. Thank you very much for coming today. We got a great class lined up for today. If you're new to CoFIT-20, my name is Todd Robbins. I'm a physical therapist. I own Robbins Rehabilitation East. And when COVID-19 started, we decided we wanted to put some information together for people at home that couldn't get out of their house, and some good education. So we call it CoFIT-20 because we're looking past COVID-19. Things are starting to open up a little bit more, so that's exciting. And we're still open in all 3 of our offices and treating patients. So, but thank you for coming today. And if you've come in the past, thank you for coming in the past. So we have a great class lined up today. Jay is going to be teaching us all about hip, trunk, core stability type stuff and mobility. So he always gives a great class. I'm excited about it. Just a few things that I want to share with you. First of all, if you know anyone that wants this information, I encourage you to share it with them. We give the information for free. We just want to give back to our patients that have been supporting us for 16 years now and give them a little bit of something to do at home. But any of your friends can take a look at it if you feel like it's good information for them. So if you can share that for us, that would be great. And we are getting down to the end here. We've got 2 more after this class, 2 more CoFIT classes. Hard to believe we got through 20 already, but we're getting there. So we'll be wrapping up next week. Our classes are on Wednesday and Friday at noon. So this will be this week. There's another one on this Friday, and then we'll wrap up. I think we got 20 next Wednesday. That's crazy. So just a little bit of our medical disclaimer here. So I got to do this part. If you're having pain or problems with any of these movements, please stop doing it or adjust it or modify it. But pain is a message telling your brain that something is not functioning right, okay? And really what you should do is seek the advice of a medical professional. Luckily for you, we are medical professionals. So we're physical therapists here. We can evaluate and treat whatever is going on. So if you do have a problem, for all of our CoFIT-20 class members, we offer a free evaluation in any of our offices. So if something isn't feeling right while you're doing this, absolutely for free, you can come and see us and have us check it out. So if you can get out of the house and get to us, we'd love to take a look at you if you're having any problems. So let us know. Again, this is educational, so it's not meant as medical advice. If you're having any problems or if there's anything that would prohibit you from doing these, please stop, be safe, and then you can give us a call. Otherwise, or you can kind of comment in there if you're having problems with anything. Put your comments in there, and we'll be able to answer them as we go along. All right, so without further ado, we're going to get on to Jay's class today. I'm really excited for this one. Almost all of my patients can use some good core stability. Like, this is the foundation on your body. So I always tell my patients, like, here to here, this is where you got to be good, right? It doesn't matter if you have strong arms or legs. If you're not good here in your hips and your core, you're going to be in trouble. So Jay is going to get us through all that stuff today, and I'm really excited to see it. So thanks for coming, guys, and put your comments in the box if you have any questions, and we'll be following along with you. So without further ado, Jay, you can take it away.
Good afternoon and welcome back to yet another edition of Robbins Rehabilitation CoFIT-20 instructional and educational classes. My name is Jay. I'm a physical therapist assistant here at Robbins Rehabilitation, and you may or may not have seen me. We have several therapists and awesome folks here for you to work with should you need to come in for therapy, and some of you may be very familiar with us as well. You may be very familiar with a lot of the exercises we go through in these videos. So they're really good ones. If you need some re-instruction or have any questions, you can always go back and find these videos. Give us a call, send us an email, any way you want to communicate with us, and we'll get you up to speed on all of these classes that we have been doing. We're getting close to the end, so we want to say thanks for tuning in every week if you have and doing these things with us. We love preaching what we work with here. We're all very passionate about our exercise, about our movements, and about helping others heal and promoting that throughout the community. So we're really glad you guys are tuning in consistently and joining us for your lunch to get moving. So thank you. And today's class is about hip, core, trunk, stable dynamic movement. What's that all about? All of our motion, more or less, generates from the core in some way. If you want to reach, if you want to kick, If you want to get up on your surfboard or your snowboard, we're very core centered and everything radiates out from a stable, dynamic core. So we want to make sure we have lots of mobility and lots of ability to move around comfortably and safely with good range of motion, because what we want that for is economy of motion, is quality of motion, is our ability to do everything very efficiently, effectively. If it's for sports and performance, you want to do it to your maximum ability as much as possible. Repetitively, we also want to prevent injury, and we want to recover from injury should that be the case. So we want to always have a nice, stable, dynamic core. So stable structure supporting and generating movement, and dynamic, our ability to have good range of motion, flexibility, dynamic flow in all of our movements. So we can perform, we can get up and down out of a chair and have no pain if possible. We want to make ourselves as happy and healthy as possible. So today's topic again is trunk, hip, and leg stretching, and for a supple, stable core and movement, and also for decreasing and preventing back pain. So again, as much as our movement is centered out of the core, a lot of our explosive power is driven out of posterior chain. So the back side, especially down here, right above the hips, drives and generates a lot of force, and the support comes from the core. So think of your core not just as these muscles. It goes pretty much from here to here. So there's a lot of mobility, strength, stability, a lot of dynamic motion coming out of all of that stuff. So again, all movement generates more or less from the core. So a supple and stable core is important for mobility, freedom, and quality of movement. And we can also then expect to see a decreased incidence of pain. The better and stronger and more supple and more mobile we get with our core, all those things, strength, stability, mobility, the better we get at all of those things, the healthier we can be and the healthier movement we can achieve. Economy and quality of motion for performance, minimal amount of effort for maximum amount of result. Quality of motion, no wasted movements, and quality of movement for balance, for force transfer, and for efficiency. So really good things to think about with a core-centered approach. So you can expect, again, performance enhancement with proper stability, dynamism, dynamic stability. You can expect a safer set of movements. You can move very safely, effectively, and you're going to prevent injury. So we want to have longevity. There's folks of all ages and physical backgrounds checking in all this, and everyone's coming to this for different approaches. We have several patients in the clinic that come in for therapy before or stay after to watch these, and they're all from at different levels, at different ages, and different body types, but everyone benefits from all this stuff because we all want to have a longevity in our movements and our ability to get around and live pain-free lives if possible. So that's what this is all for. So a core-centered focus is important. And again, movement radiates out from the core, and that's where we drive it from. So our control with the core equals comfort in our movement. Our mobility equals freedom of movement. So we can move around effectively and comfortably, and we want to have lifelong mobility as our overall goal. Yes, we may be thinking of athletic performance and other things, but really we want to be athletes for the rest of our lives. We want to be mobile for the rest of our lives. We want to be pain-free for the rest of our lives as much as possible. So this stuff is pretty darn important to do. So how do we achieve that? How do we get this supple, stable dynamic core. How do we get this thing that we want to have strong for bracing and mobility effective for movement generation? We're going to do that through stretching, through exercise, through core strengthening, a lot of stretching and a lot of dynamic stretching. So we're going to go through that stuff today, the stretching and the exercises. Some stuff you can do on our little lunch break here and get you going. So we're going to come right into it. Today's class is pretty movement based, so we're not going to need a lot of equipment. A yoga mat is helpful. If you have a ball, we're going to have a ball with that. So if you have a ball, break that out. If you don't, it's not a big deal because we can do stuff with that. So I want to get into some stretches with you guys first. So with our hip mobility, and if you remember, a lot of movement is generated by the posterior chain, back, glutes. Moving forward is a rearward kick. So these can get pretty darn tight. And so we want to have some good mobility there. And think about if we want to bend down and pick something up, we don't want to bend from the middle back. We have a whole lot more range of motion in the hips. So we want to use that. And this is a really good test. This is called a deep squat stretch. So what we're looking for is the ability to keep our heels planted on the floor. We're going to have our feet about a shoulder's width apart. And we're just going to sink down, if you can, keep your core nice and stable. Engage your core. We're not bending at the back. We have a nice upright back, upright chest, a proud chest and chin. We're sinking our butt back, and we're going down into a deep squat stretch. It's awesome if you can sit into this without falling backwards. It requires a lot of ankle flexion, good knee mobility, a nice strong back, and a lot of mobility in the hip. So let's hang there. If you have trouble getting into that, you can raise up and put something under your heels. Roll up a pair of socks. You can use maybe some little therapy balls. Put something under your heels, a phone book, something small just to give you a little bit of lift. If you're having trouble getting down deep enough into this one, if you raise your heels a little bit, you can sit right down into that. And you want to have a nice straight back. You've got a lot of ankle flexion. You're pulling up through your anterior tibialis muscles, and you got a nice supple posture here. It's a lot of hip flexion and mobility here. If you can do it little by little, take your risers away, get flat with the heels, work your way down into this to get a nice flat heel and a nice stance. So it's a good thing to work for to try to achieve that mobility. So it's called a deep squat stretch. Kind of hang here, maybe you rock from foot to foot. You're really working on ankle flexion, getting the knees forward, getting your chest and chin upright, and a lot of mobility in those hips. A good place to be for using your legs to pick up heavy objects. So when we want to lift out of the legs, not so much out of the back. So that's your deep squat stretch. Again, your shoulders width apart, feet are facing forward. You're just coming down, sinking into those heels, and getting a nice stretch. Generally hold these for 30 seconds to a minute with a nice strong core, and let your body settle into this. So now that you're here, let's move on to the next stretch. So this sequence is pretty cool. We're going to do our hamstrings and a lower back muscle called the quadratus lumborum, or the QL. These are both very heavily used muscles, and they can be drivers of pain if they're not stretched or elongated. So this is a good way or a good thing to have stretched to fend off back pain. So first thing you want to do, want to stretch your hamstrings. So we're going to come into whatever of a gentle split you're comfortable with. You're gonna have a nice straight back. We're not bending the back. We want to be up and proud with the chest and chin. We're gonna rock the hips forward. So let your body settle into this. We're just getting forward. You're thinking about having a nice straight back, engage your core. You can hook your toes back towards you, really engage your quads, get the most out of this. And just little by little, you can walk this down to whatever's comfortable. If you can get here, it's great. If you can get your nose to the ground, your legs straight out to the side, that's phenomenal. I've been doing this stretch for about 45 years, and I can get my elbows to the ground and a little bit more. And that's about all I can get. So this is a very good stretch to do. You're going to feel this right through here. You know you're being effective. And try not to bounce. Just kind of hold that. You're breathing in and focusing on the exhale. Holding these for roughly 30 seconds. Again, you're rocking your pelvis forward. You're not bending at the lower back. Hinging at the hips, bringing that all forward with a nice supported, stable core. Draw the belly button in towards the spine. Exhale into your stretch. Keep your toes pulled back, letting that descend and get nice and stretched out. So that's a very good complement to the ankle stretch we just did. The next thing we're going to do, while you're sitting here on your sit bones, curl one leg in, bring it tight, and we're going to do two things here. First one we're going to do, we're going to turn our upper body towards our extended foot and leg, and we're just going to reach out and draw towards that. So again, I'm reaching forward with my upper body. I'm not bending down so much. I'm reaching forward, getting a nice stretch there. Hold on to these for about 30 seconds. Just getting a very good stretch. Just let your body breathe into this. Let your body naturally open. You don't have to force it, but you do want to be consistent with these. You want to do these as many times as you can. Be consistent with this during the week. If you stand a lot at work, if you're an athlete and you're working really hard, you're going to really want to get this loosened up. And then another variation of this is to then sit forward, kind of cradle your hand in the leg, put this hand up, turn towards it, and reach your hand towards your foot. I had showed this to a patient yesterday, and she told me she used to be able to get her hand to her foot. I've been doing this for about 30 years, and this is about as far as I can go. So that was impressive to see. So the posture with this, you've got a nice stable core. Your back is pretty much straight up and down. I'm going to drive my elbow towards the ceiling, and then I'm going to reach. And someday I may be able to reach my foot, but I doubt it. But anyway, you want to get this nice stretch. You can look up towards the ceiling, really open up that chest, engage your core, and exhale into that. So that's a very good stretch. And then breathe, sit up tall out of that. We're going to reverse the legs. And again, we're going to turn towards our extended leg, cranking our toes back towards us. We're going to sort of turn our upper body to get it centered and driving down towards that leg. So softly coming down. Let the body open into that. Just breathe into that. Your chest and chin are up and they're proud, and you're more reaching forward and looking for a downward bend. You're looking for length in the back. Opening up the back. Letting the lower back, the quadratus lumborum, open. You're going to feel that pushing your knee towards the ground, keeping your core nice and drawn in, creating space in the posterior chain, opening up that space. And then we're going to come up and recenter at our hips. So our legs out to the side, our knee is out to the side. We're going to cradle our arm in the lap, going overhead with the opposite hand, driving my elbow towards the ceiling, looking for length and opening here, pushing those ribs on the right side towards the ceiling, drawing the core in, and letting our body open into this stretch. Breathe through the stretch. Reach out with the hand and let everything open. So gently come out of that. That's a very effective opening sequence for a stretch. Okay, the next thing we're going to do is we're going to roll on to our side. So it doesn't matter which side. We'll do both sides. So we're going to lay on our side, keep our knees bent. We're going to hold on with the opposite arm to the opposite knee and just turn our head and shoulders to the opposite side. Exhale down into that. Let your shoulder reach towards the floor. And exhale your core and your trunk, allowing the rotation to gently take place. We'll do that for about 30 seconds, just allowing that to open. If it feels like you're not getting enough stretch, you can straighten your bottom leg. Bring your top leg knee to the floor and keep it there and try and get even more. So you just want to find a comfortable spot with that. It's either both knees or single knee. Lumbo-pelvic rotation. So we'll try the opposite side. Again, you got your knees bent. You're going to hook the knee with your opposite hand, reaching for opposite shoulder, stretching, opening. Hold on to that for about 30 seconds. You may feel that stretch in your glutes and your piriformis muscle. Opening up the posterior chain, opening up the spine, letting the spine breathe. Draw your shoulder, your thoracic spine towards the floor. Exhale into that slowly. Every exhale, let the rotation go a little bit deeper every time. So it's a very good stretch. That's called a lumbo-pelvic stretch. So when you're ready, come on out of that one. We'll gently come on up, and then we're going to go into a half kneeling position. Okay, so when you get here, this is a very good stretch to do for the hip flexors. We do a lot of sitting in our day jobs, in our cars, on our motorcycles and bicycles. So we can get tight in the hips and the hip flexors. So it's important to get them extended, get them opened up and loosened. So we're going to come into a half kneel. One knee's on the ground, one knee's in the air. We're going to keep the hips nice and level. Think of your hips as a bowl of soup. We don't want to spill the soup. So we want to bring the soup forward. So I'm just bringing my trunk forward. And I'm going to put my opposite hand on the opposite knee and give a little bit of a rotation. If that feels pretty good, you can also then lift that forward hand as you support your core. You get a nice stretch on the iliopsoas muscles, front of the hip. Breathe into that, just let that come open. Do that for about 30 seconds. And then from here, that's a very good stretch, and this is a perfect transition to the opposite side groin. So the hip adductors, the ones that pull together. We're going to get those too. So put your hands on the ground, and the hand that is inside the ankle, we want to drop that elbow and sink our trunk and upper body into that stretch. You can kind of fish it forward and backward. Find your stretch there. Keep your core nice and tight. Keep your opposite elbow straight. You really want to get a rotation into this. And find your spot there. We do that one for about 30 seconds, and then from that we can transition into the next. Coming up. Again, we're going to hold our bowl of soup nice and level. We're going to scoot forward. Exhale. Opposite hand plants. Get some rotation. Scooping forward. That feels pretty good. Raise your hand and really feel that through your hip flexors. That's a very effective stretch. Breathe into that. Hold your posture. Hold your core. We've got the hips counter-rotating. So they're both active. They're going opposite directions. They're maximizing their mobilities. And we've done both sides. So now we're going to dip into the groin, the hip adductors, dropping the elbow that's beside the leg. Getting a nice stretch out of that. Hold that for about 30 seconds. You can drop your elbow to the floor. You'll be in a good spot. So a very good stretch to do. A very good sequence of events. So that's a lot of really good stretching to open up the hip, trunk, and now we're going to do some core exercises and stuff for the lower back. So let's go right into that. So we just did a lot of trunk, hip mobility. I want to show you guys one that's a little bit more for the thoracic spine and cervical spine, so the neck and shoulders, and it's a really good one to do. You want to come to hands and knees. We're going to plant our hands about a thumb's width apart, so I'm pretty close with the hands. I've got a nice level spine. I'm going to keep my arms and elbows straight. I'm going to push in with my right elbow, or sorry, my right arm. I'm pushing into the floor, and I'm going to lift my left side. Keep my core engaged, and now I'm going to raise my hand, follow it with my nose, following the thumb, and going for a nice stack between the middle finger, upward shoulder, my head, my lower shoulder, and my hand on the floor, looking for distance between all of that. Rotate out of it. And again, we're going to reach up high. We're looking for distance between hand, and you want to have a nice set of stacked shoulders. We're going for as straight of a line as possible. So a very good stretch to do. You don't really have to hold this one. This one is more about frequency in the opening. And that's going all the way to your hip. So you may feel some imbalance, or you may feel some more stretch on one side than another. There's nothing wrong with that. It's pretty natural to have imbalance or a deficit on one side and a little bit more movement on the other. That's a natural thing, not a big deal. So still from hands and knees, now we're going to do a nice stretch for the lower back in two ways. We're going to sink back into what we call child's pose. So we'll sink back to our heels and push our shoulder blades up over the ears. You're looking for length between your fingertips and your hips. You want to create length between fingertips and the hips. Letting the head relax. And then from there, we're going to come across and low. And we're going to come up into a cobra. Keep your core nice and tight. Just let your hips fall to the ground. you're pushing your spine up between your shoulders. So this is scapular depression. You're pushing your shoulder blades down. And then we'll sink back into our child's pose, and now our shoulder blades are going to go up around the ears. So whatever it takes, you can stay low, you can come up tall and just drop right back into your cobra. And again, shoulder blades are pushing down, spine comes up in between. You can tilt your chin back, get a nice length out of your cervical spine, and then sinking back into cobra. That's a very good sequence to do numerous times a day, as many as you want. That's just a really good thing to make your spine nice and supple. Okay. If you do have a therapy ball, you can break it out. And this is a really good exercise for the lower back. We're gonna come grab your ball. We're gonna come on to the ball, and we're gonna come to our hands and toes. I'm on my toes right now. I've got my pinky toe through my big toe. And what I'm gonna do, I'm gonna hold the core nice and tight. I've got my back supported, I've got my fingers wide. My core is drawn in, and I'm gonna lift opposite arm and opposite leg. Now I'm not looking for maximum height. I'm looking for a level lift, and I'm looking to push distance between my middle finger and the bottom of my heel with my core engaged. You're looking for that distance, extending, keeping the core tight, using your lower back muscles, stabilizing your trunk, and we're gonna switch. So get your toes engaged, lift opposite arm, opposite leg. Again, you're not going for height. You're going for level and extension, middle finger through to the heel. Get a nice core hold with that. Holding on, and come on out of that. So that's a good one. That's called an alternating Superman. Opposite arm, opposite leg on the ball. Okay, this next one is going to be a little tougher for the hip. We're going to use our ball. If you don't have the ball, you can do it just with your arms and legs. But if you have the ball, we're going to lay them back, and we're going to grab the ball with our feet. We're going to lift the ball, pass it off, drop the feet, and switching back and forth. Keeping the legs nice and straight, keeping my core engaged, and keeping my back flat to the floor. You want to think about having a very flat back. You don't want your back to arch up off the floor. You want to keep your back flat. You're using your core muscles to support the spine, keeping the spine flat to the floor. Again, you're lifting the ball with the core, dropping the legs, dropping the arms, reverse it. Lift with the core, dropping. Pretty simple. Do about 50 of these, and you realize how much your core works with all of this. Don't forget to breathe through that. It's a very good exercise. Stabilization, supple movement in the core. The ball adds a little bit of weight and complexity. It's a good thing to use with your exercise. So you may get a little tight in your hip flexors. You can go back to your half kneeling hip flexor stretch to get that going. So my last exercise we're going to do today, we've built up to this one. We're going to do a bridge with a kick. So this one's pretty tough. All the other exercises sort of got us rolling to get to that. So we're gonna come back onto our back. We're gonna push up into a bridge. My core is engaged. Got a nice tight core with my knees at 90 degrees. I'm going to keep this angle. I'm going to stabilize and level my hips. And I'm going to drop up and back. Up and back. And come down. So the sequence there is to push up into a bridge, maintain your 90-degree angle, tighten the core, and then when you lift this leg, your hips are going to want to dip, but you got to keep them level. So it's a dynamic stabilization with the hip. Try and keep your elbows off the ground, stabilizing with the core. It's really fun. You're going to love it. As many of those as you can comfortably do. If you're having trouble with the lift exercise as well, you can come up into the bridge and just bend one knee out to the side. So you can push up, bring one knee out to the side, keeping the hips level. Opposite side, hips level. That's also a very good exercise for the core, for the hips, for a stable spine, for dynamic stability, for movement quality, and supple spine. I want to keep you guys moving. I want to keep you happy, healthy, and dynamic with your movements. So that's what I've got for you today. I'm really thankful you guys are tuned in. This is my third class and the last one I'm going to do for now. I may do some more in the future. But if you have any questions, please don't hesitate to give us a call. Email us. You can check us out at robinsrehabilitationeast.com. Our Facebook page always has this stuff on there. So lots of information out there for you guys. But keep moving, keep exercising, and keep healthy, and have a great summer. We'll see you soon.